Okay,
Okay.
sir. Good evening.
Good evening, nurse.
I'm Nancy, one of the registered nurses working in this emergency ward. Please be seated.
Thank you.
How can I address you?
You can call me as Sanu.
Please, Hina. Could you please tell me your reason behind your visit?
Oh, actually, what happened? I'm the way of my friend house. Suddenly, a dog came in front of me and rushed up to me and bite in my leg. It's bleeding and it's very painful. I don't know what to do. Can you do something for me, please?
Okay, I can understand your concerns, but nothing to worry about that. We can manage this situation effectively. And firstly, I assess your wound site. Can I do that?
Yes, of course.
Okay. Okay, thank you for your cooperation. From my assessment, I notice this is a superficial wound. There is no need for any sutures. So I will give the first aid treatment right now. Is that clear?
What are you saying, nurse? It's still bleeding. I have heavy pain. It's pain like something, I'm not saying it's superficial. I cannot believe this. Can you call the doctor now?
Okay, I will call the doctor. Before that, I will do the first aid treatment. Can I do that?
Okay, without suture, how it will heal?
Okay, I clean the wound effectively. After that, I put some ointment over there. At this point, there is no need for any sutures or bandages over there. Did you getting my point?
Okay, please check this one, but first of all, and then you decide.
Okay, I will do that. Firstly, I clean the wound and I will put some ointment over there. And you need to open the wound and the wound need fresh air. Then only the wound will heal properly. Am I clear to you?
No, I'm not clear. What are you saying? I need to open this site?
Yeah, there is no need for any sutures
Nurse,
or
can you see
bandages
in
over
your own
there.
eyes? It's bleeding. How can I keep open like this?
Okay, I will clean the wound and I will put some ointment over there. So please, please keep it. The wound is clean and dry at your home. So your wound will heal properly within few
Oh,
days.
it means this blood will stop after some time. You are saying, right?
Yeah,
Oh,
definitely.
that's good. That's good. Okay.
And you know one thing, at this point you need some injections, mainly tetanus injections. I will tell you what is the reason. First reason is this wound. If you are not taking this tetanus vaccination, your wound is not healed properly. And the next thing is if you are not taking this vaccination, there is a chance of getting tetanus. It's a fatal condition. So better to avoid that, you can take this vaccination right now. Are you willing to do that?
Wait a second. Nurse. Actually, I have done it this one before 12 years ago. I think I don't need a physician because I'm very afraid of physician from my childhood. Please, I don't want.
I can sense your feelings. I know you are very, very concerned about that. So please take this vaccination. Then only, if you are not taking this vaccination, it may badly affect your health. In order to avoid that, you can take this vaccination right now. There is no any side effects when you are taking this vaccination.
No, I told you I have taken 12 years before. It's not enough.
I know that, but this tetanus vaccination we need to take every 2 years. So
Oh, I
that is the
see.
reason I am telling you to take this vaccination right now. Did you get my point?
Yeah, that's brilliant.
And you already mentioned you have some pain, so I can give some painkillers. So you can take this pain medication. and
Mm.
within few days your pain will be subside. Did you get my
Okay,
point?
I need to apply some topical application like ointment or something, because these things, I'm afraid of dog, and I may have worried about this dog bite.
Okay, I know it's very hard for you, but at this point, I will do the dressing and I will put the ointment. So you can do this dressing at your home. So I will give all necessary equipments to you, so you can do this dressing every day. Do you have any other concerns or
No,
anything?
no, thank you so much. You have been so helpful for me.
Okay, I hope I clarified all your doubts regarding your present problem, a dog bite. So I reassure you that you can follow my advice. You have a better recovery. Thank you. Thank you for listening.
Yeah, thank you so much.
All right. Both of you have done a wonderful job. I just would like to give you the feedback first, and then I will provide you the overall score. Okay. So the first thing is you have mentioned your reason, and then you say behind your visit.
Mm,
Your reason behind your visit. Okay. You should have mentioned the reason behind your visit.
mm,
All right. May you know the reason behind your visit? So
mm,
that's the correct one. That's what the sentence. But you didn't use that properly. And then you said, but nothing to worry about. Okay, you said, but nothing to worry about. Well, this is not a complete sentence. I think I have told you this, that you have to use grammatically complete and correct sentences. Okay, you have to say, but there is nothing to worry about. Okay, there is nothing to worry about. That's the correct sentence. Otherwise you can say, but you don't need to worry about. Do you know what I mean? Something similar to that. Okay, but you don't need to worry about. Okay, worry about that or whatever it is. Okay, so it should be a complete sentence. All right.
mm,
And the other thing is that remember that you have to give small pauses of 1 to 2 seconds between two sentences, any two sentences. You have to give a small pause. But unfortunately, you have been talking continuously without giving a pause.
mm.
Okay, either you give too many passes or no passes at all. Both of them are very bad, unfortunately. Okay. And then this time, one of the good things is that I think you have reduced the frequency of false starts to some extent. I'm happy with that, but still there are a couple of things. Okay, you said thank you twice. Okay,
Mhm,
so false starts need to be reduced or avoided. But at least
mm,
to some extent, you were able to reduce the frequency. So I'm very happy with that.
mm,
And then you said, can I do that? Okay, when you have to do some kinds of procedures to the patient, especially the ones who has been bitten by a dog, okay, in the emergency ward, it's better to use more formal phrases. Okay, more polite phrases need to be used. Okay.
Okay.
So you could have said, for example, I understand how painful it is after being bitten by a dog, but I can do a few things in order to help you reduce your pain and bleeding. Are you happy with
Mm,
that? So use these kinds of phrases, and then once she says yes or no, or whatever it is, and then you can say, firstly I would like to do this, and then after that I would like to do that. Can I mean, you can say, can I please proceed, or you can say, may I proceed? All right.
mm,
So instead
mm,
of saying simply can I do that, it's better to say can I please do that, or you can say, uh, is it okay with you, or you can say, I would like to do this, or you can say, may do that. So those kinds of phrases are more formal. All right. So it seemed to me that you're not able to use some polite words, formal phrases. All right. That is one of the most important things that you should have addressed. And then you said, did you getting my point? Okay, you said, did you getting my point? This is wrong.
okay.
This is wrong. You should have said, did you get my point? Okay, that's the correct one.
Mm,
All right. So it was the issue with the use of verbs. And then the other one is you said antibio, and then you said ointment. You didn't finish the previous one, so it's again a false start. Okay. And then the next one is you said the wound need fresh air. Okay, the wound need fresh air, but that's wrong. It's needs fresh air. Okay, so this is what you said, but that's wrong. You have to say the wound needs fresh air. Okay, to get healed. All right, so you should use, see, with all the third form singular nouns such as he, she, it, we need to use only verb plus yes, unfortunately. Okay, the procedure involves, okay, the wound needs, all right, the medicine needs to be taken. You have to use needs. Okay, don't use need. Okay, use more empathetic phrases as well. You know, the empathy and caring were not shown enough, you know. All right, you should use more empathetic and sympathetic phrases. Sorry, empathic should be 1 minute. Sorry, I have written on this. Okay, yeah. Phrases to the patient. Okay, so don't use you know the words, you know, that do not show care. You have to use those kinds of phrases. You know, you can use, you know, personal examples as well, you know, when you have to elaborate all those things. You can say, I also have experienced, you know, dog bite in my childhood, and I know how painful it is, so I'm trying to, you know, help you out as much as I can. So use these kinds of phrases. Okay. Wound is not healed properly, so you said wound is not healed properly, so this is wrong. So wound will not be healed properly, will not be healed properly. Okay, if you don't follow something, so that's what you have to say. And then you said there is a chances of infection or something, but you should say there is a chance of. That should be a singular noun. Otherwise, you can use, if you want to use the plural noun, then you can say there are chances of, and then you say this as, you know, whatever you want. So when you use, you know, a singular noun or a plural noun here, you know, the previous verb should be in the same form. If it is a singular noun, a chance, you have to say is. There is a chance, or there are chances. Okay, you have to be a bit mindful about that. All right. You were unable to persuade the interlocutor to some extent. It's not good. You have to persuade them. Okay, there is no any side effects. Okay, there is no any side effects. This is wrong. Why? I'll tell you. There are no side effects. You don't need to use any and no together. They are the same thing. Okay, that's the first mistake. And then the other mistake is with the side effects, which is a plural noun. You can't use is, which is a singular noun. Do you understand? It's a singular verb. Okay, you can't use that. Okay, and then you said, so better to avoid. So better to avoid. That's wrong. So it is better to avoid. You remember, you have to use only the full sentences. So it is better to avoid. Okay, you have to use full sentences only, the grammatically complete sentences. All right, remember that. Okay, so you said this tetanus injection we need to take every 2 years. Okay, so you said this tetanus injection you said we need to take every 2 years. So the way we have to say is that we need to take this tetanus injection every 2 years. Okay, that's how you need to say. All right. Okay. Pain will be subside. Pain will be subside. That's wrong. Pain will be subsided. Okay. Pain will be subsided. Okay, you should use the third form of the verb, that is otherwise known as past participle verb. All right. You said but at this point. Okay, you have repeated but at this point. Okay, so false starts are not good. And then you said equipments to you. So equipment itself can act as a plural noun or a singular noun. There is no word like equipments. This is wrong. Okay, I'll provide you some equipments to you so that you can do it at home. That's what you have said. But equipment itself is a plural noun. Okay, it can act as a plural noun or a singular noun. Okay, so equipment to you, that's it. All right. Pronunciation could have been a bit better by reducing your speech rate. Okay, you were talking a bit faster, without any gap in between. Connectivity has been improved a bit. Grammar still remains to be an area of improvement. You were able to share the information to some extent well, but you could have used more kinds of phrases to link the sentences together. But apart from that, it was all right. It's not that bad. Okay, it's not that bad. Background noises background noises and long hesitations were reduced dramatically. So I'm very happy with the way that you have worked out on this. Okay, so you have still committed some background noises, but it's not that bad. Okay, it has improved a lot. Okay, when compared with that of your previous role play conversations. Only the grammar is very bad, so you are not able to produce grammatically correct sentences. Okay, in some part of the the role play conversation. And then the other is that you have to use more sympathetic phrases. Okay, you have to show more sympathy towards the patient. You need to persuade the patient. It was missing according to me. Okay, it was not that good. You could have used more sympathetic phrases and then got the patient undergo whatever the operation or so on. Anyway, the expected score is, to me, this sounds like 330 out of 500. Great role play conversation. All right, it's not that bad, but
Congrats, Ansi.
why? She scored only 330, right? Isn't it?
No.